Okay.
Wow. Thank you for being here, Steve Miccio, founder, CEO of The Rose House.
Good to be here. Thank you.
Welcome to the show. This show is all about really telling people about alternative treatments, alternatives to what is called the norm. So, you know, and basically things that are going to help the system, which, for lack of better terms, doesn't always work properly, I like to say.
Good. Yeah. We definitely don't follow the norm, but I think we're trying to create a new norm in what we're doing.
That's wonderful. That's wonderful. So tell the people a little bit about who you are, where you're from, what you're all about, and how you got to where we are right now.
Sure. It's a long story, but I'll
Mm.
shorten it. Basically, where it started for me was I worked in the developmental disability field for years and had created some affirmative businesses, back almost 30 years ago. But then I had problems, and I knew I was having trouble with my mind and what I was thinking about and how I was thinking and how I was behaving. And I ended up in an inpatient psychiatric hospital. And so that to me was the beginning, the end of one career and the beginning of another. Soon after I was discharged from the hospital, I had been let go from the company I was working for. And again, can't prove the discrimination, but it was there, the fear of the mental illness. Sorry. And then so the story is I went in as Steve Miccio. I came out a mental patient from the hospital. It wasn't a good experience for me. There was not a lot of discussion about hope or recovery or, a better quality of life for me. So I really was beaten down. My self-esteem was very low. I was very depressed. I was labeled with bipolar disorder. I was on medications that I didn't understand, didn't know what they were supposed to do or how they were working for me. So it was hard for me. And what gave me that vision of hope, or lent a vision of hope to me, was I read about this bipolar support group that was happening in my community, and I went to it, and it was people with lived experience of being diagnosed with bipolar disorder. And I heard my story come out of every word. Every person's story was like, wow, that's me, I've done that, I did that. And so it really lent that vision of hope for me. And in the meantime, I had found another job. It wasn't related to mental health so much, but there was a part-time opening that came up in a hospital where they're looking for an emergency room screener. So I'm recovering through this whole process and feeling better about myself and building my self-esteem again and getting my life in order. And I thought, wow, wouldn't it be great to work in an emergency room similar to where I went and treat people with the respect that I think they deserve? And I got the job, and I was the guy. I was the guy that people came in, and I made sure I had no script, but I made sure that people were comfortable when they came into the emergency room. I made sure they had food and water and shelter, whatever they needed to really deal with the crisis they were going through. And through the conversations I would have with people, I would disclose that I was, labeled with bipolar disorder, and their heads would pick up and look at me, and, I'd hear, well, you don't look like you have a mental illness and whatever. And so it was very empowering to me to sit there and actually have a peer support, engagement with somebody in an emergency room. And by the time the psychiatrist came in, they often didn't need the inpatient hospitalization because they were feeling better about themselves. And our discussion helped them, a lot. And so it was exciting to do that. And then I found out about peer programs in the country. And there was this organization close to me called People Incorporated, and they were hiring an executive director, and I applied for it. And after many interviews, I got the job. And my whole joy around that was I could work with the hospital I was hospitalized in and help them be better. And when I got the job and got into the position, I contacted the CEO of the hospital, and they just weren't interested in anything I had to say. I didn't realize the discrimination that existed in the peer world, and it was there, and it was hitting me right in the face. So through a lot of advocacy and a lot of work that we were doing, the organization People Inc. is a peer run organization, which is everybody in the organization has been diagnosed with a mental health and or substance use issue. And these were people in recovery and helping others in our community to navigate the system of care that existed or didn't exist in our community, and to help advocate with their therapists or whoever they were going to see to make sure they got better service out of what they were receiving. And through my advocacy and my I guess you would call it, demonstrations that I would do in hospitals and say that, we would pick at the hospital and talk about the poor quality of care. One of the counties that I was working in asked me if I would put my peers into the emergency room of that hospital. And that was a gift. And I was like, well, yes, I will. And so what was fortunate is my experience of working in a hospital, I had the idea of how it worked. And I could train other people to work in the hospital, to engage and provide more of a trauma-informed engagement with people that came into the emergency room for psychiatric care. And so that's where it really began, where not only were we an advocacy organization, but we were starting to provide services too. And, as much as I could throw rocks at the system and complain about it, I was like, well, you know what? Why don't I just show them? If I could show them, that would be, I think, better than being on the other side of it and complaining all the time. And so the
Better
next
than being
step
a
that I
victim.
did,
Sorry, I
yeah,
just want to say better than playing the victim card. A lot of people
that's
can
right.
do that. So I applaud you.
Thank you. Yeah, we did not want to be the victim. And one thing I noticed is that when I went to provider meetings, as the executive director of people at that point, I always sat at the head of the tables, and I did it on purpose, but quietly. And I wanted to listen, and I would be in these provider groups, and they'd be talking about how they work together and how, great everything is, but yet talk about how bad everything is because of the people they serve. So it was like a blaming group of people, like if our patients would only take their medications, it was that kind of approach. And I'm sitting there thinking, wow, this isn't where we want to be. And so through that, those experiences and my engagement with everyone, I developed the Rose House. I developed it. Sherry Mead was a big part of that. She had a place, she created intentional peer support, and she had a place in New Hampshire that I got to experience. And her and I would speak about what I was trying to create. Hers was a little different because she had to know you before you would come into the house that she was operating, and you couldn't always even stay overnight or anything. And I'm thinking, now I want a place where people can come. I don't have to know them. They have to be, experiencing some kind of crisis, but they can stay with us 5 to 7 days. And we're going to provide them with peer support, empathy, dignity, respect, everything that people deserve in a nice environment. And these are very nice environments to come to deal with the crisis, to learn how to look at their crisis differently and move forward in their own life. And so I put in an RFP, a proposal, to the State Office of Mental Health, and they funded it. And that was the first Rose House that we had started in New York. Now my organization operates 4 Rose Houses, and I've helped open about 40 across the country and in the Netherlands. And they're all very successful. They're doing really great. And I think it's changing the paradigm and the thought process of traditional norms, the traditional system, to look more to the peer community to say, this is helpful, and so we're not the panacea, we're not the answer, although we do have better answers than tradition, but we're not the answer. And if we work together, we can create a better system of care in our communities. And that's been my goal ever since I opened the first Rose House. And we've grown into a larger organization. We have mobile teams now that are all peer run. We have the first, I think, in the country, probably in the world, crisis stabilization center that's peer run. And that's the most exciting thing we're doing right now, is that between that and the Rose Houses and our mobile teams, we're having fun with it because we're treating people with that dignity and respect. And we're getting so many comments back from our guests that are saying, nobody's ever treated me this way before. Nobody's ever asked me those questions. This is strange to me because you're all so nice. It's those kinds of comments that we're getting constantly from everybody we're serving. And the better part of it is that they're getting better. They're doing better themselves. And we're not telling them how to do it, but we're educating them on how they can do it, and they choose how they want to go down the path. And it could be traditional services, it could be psychiatric, it could be medication, it could be, programs or whatever. But we help them understand that they should expect something from everything they engage in. So what's your expectation with a psychiatrist? What's your expectation with your therapist? Build not just the beginning and the middle part of things, build the end with your, provider. And that's what we aim to do in our organization. And that's I think what's been our success, is really working, on an individual basis, non-medical model. And if people do need the medical pieces, we can get them to those, those providers should they need it. But we've been really successful over the years in building this.
That's great. And this is also an alternative to incarceration.
Absolutely. We train the police in CIT training, which is crisis intervention team training. They get 40 hours of training on how to engage people that are dealing with addiction or mental health issues or even developmental disability issues. And then we educate the officers on how to resource the services in the community faster than using the emergency room, or faster than bringing them to jail. So they're educators themselves now, the police, where they can say to someone, I can arrest you, I can bring you to the emergency room, or I can bring you to the Rose House or stabilization center. And they'll explain that to the individual. And most times they will choose coming to us at the stabilization center or the Rose House. And there's that alternative to the incarceration right there.
Yeah, that's great.
Yeah.
I don't know if you know anything about my story, but I was diagnosed with schizoaffective disorder. And so I had several hospitalizations as well.
Mhm.
And many of those hospitalizations were actually in Germany.
Oh, wow.
So I was living in Germany for over a decade, and I got to see what the system was like over there.
Was it
And
any different?
it was actually quite good.
It was. Yeah.
And there were places that people could go to instead of the acute station or the ER or anything like that. There'd be places called burnout clinics.
Oh, wow.
And so if anybody was working too much, or you felt like you didn't want to live anymore, things like
Yeah.
that, you'd go to this place where you'd have some arts and crafts and really nice, cozy environment. And people would do this for maybe like 2 weeks, and it'd be paid for by the health insurance.
Wow. That's nice. See, that's along the lines of what we're creating and doing, as well.
I wanted
So,
to share that with you.
yeah, thank you so much. Wow. That's good to know.
Yeah. And I even thought about for myself, because, doing the show and, pushing myself all the time now. And I feel like I'm getting burnt out. I want to go to a burnout clinic,
Yeah. Yeah.
even for a couple of days. And I was thinking about doing this over here at this local one near where I live. And they said, well, they didn't have food, and then I would have to go out and get the food. And I said, well, then I might as well stay home.
Mhm.
So I mean, maybe you can speak
I
to.
can, yeah, I might be the culprit that created that. Because what happened was when we first opened, we fed everybody, and we would bring food into the house, and I wanted to make sure everyone was well nourished. We still do that to a degree, but we do ask people, because I think part of the recovery for folks is to also stay involved, with their normal life, as we want to call it, I guess. So bringing food in helps us with our budget, because it got very expensive. We noticed that everyone that would stay at the house they'd eat a lot, and which was great, but our budget was being eaten up so much. So we started asking people to bring their own food with them. And the nice thing about it is that when you have several guests in the house and people have brought different foods in, it's a family style kitchen, and people make their meals together and they talk and they get to know one another. So it's peer support in the kitchen, it's peer support in the dining room, peer support in the living room. And so that's why we did say that we would like people to bring their own food, but nobody ever goes hungry. We always have food in the house. We have well-stocked closets, and but it's just it is, again, something to help people understand that we're going to take care of you, very good care of you, but we want you to take care of us a little bit too, and have that mutual relationship with people. And we want you to own the house when you come to it. And oftentimes that's what happens. So it's been very successful. And like I said, nobody's ever gone hungry. So some people do come and say, I don't have any money. I don't know if I can, come and I'm like, no, that's not a qualifier. Please come in. We'll definitely help.
That's
So
great.
that's how it started.
And you also offer round the clock emotional support.
Absolutely. 24 hours. Yeah. Staff are awake 24/7, whether it's stabilization center or Rose House. And if you can't sleep, and I remember the hospitalization was, bedtime was like, 8 o'clock, 9, whatever it was, they told us to get in your rooms, go to bed. And I know that for me, I was like, it was nighttime. I was awake at night, and I'm like, I don't want to lay here in bed. I want to go watch TV, or I want to go out in the common area, as they called it, or whatever. And you'd step out and get back in your room, that like, why does that make sense? And it didn't. So absolutely, at the Rose House, you can be up all night and have someone to talk to and get support.
Bring your
whatever you need.
laptop.
That's it. Yep. Yeah.
That's great. Is there a number that we can give the people so that they can reach out and find out more?
Yeah. It's 845-452-2728, and they'll get a whole menu of services. They can connect to the houses, they can connect to the mobile, they can connect to whatever department they'd like to get to seek out what services they want.
That's great. That's great. Now, is law enforcement informed about these options as well?
Oh yeah, when we do the training, we educate the officers on all the different services in the community. So we're not the only 24-hour service. So we educate them about ours. We educate them about the detox that's open and that will accept people right away without going through emergency rooms, the rehabs, any other programs that are out there. But generally, a lot of people now come through our stabilization center anyway. It's just easier for the officers and the individuals in the community to come to us in that way. But everyone, they are well educated now, the officers.
That's great. That's great. And if a person like myself, I consider myself to be a peer also because I've been through the gamut, the
Sure.
system,
Yeah.
What does a person have to do to help out? How can I help? How can anyone help?
Yeah, it's interesting. We've never like reached out for the help because we've just kind of, we've been not siloed because we're out there in the communities. But we just got into fund development for the organization because we could, certainly use those funds to put back into services or put back into payroll or put back into furniture or, all the different things that we have to pay for. And so now we're asking people, we do want volunteers to come in and work with us. We do like people to help us with our fund development drives. If they want to be part of our fund development committee, they can be a part of that. There's so many different ways. There is, the bartering system. If they can, have a service or something they can offer us. I'm looking for right now for the Rose Houses, any barbers or beauticians or people that would be willing to come into the house and
My mom.
do haircuts, right?
My mom.
Oh, okay. Yeah, I mean, just imagine, how good it feels when you go to a spa. So why not bring the spa into the house a little bit, and anyone that wants to do their nails and their hair or get a haircut or whatever, it just makes you feel better. And so why not contribute to that? And I would love musicians to come to the houses. So we have professional instruments in the houses. We have professional art equipment in the houses. I would love for artists and musicians to come in and have jam sessions and do the art with us. And so really focusing on what's good about life and not just what's the diagnosis and the bad things of life. So that we would love to bring in.
Yes, and the darkness of winter. The
Yeah.
darkness of winter. What to do about that?
Yeah. We're fortunate where we are in many of our houses. We're at the foot of the Catskills, or we're just in really nice country where during the day, in the daylight, they're out and about. They're hiking, they're walking, they're enjoying the environment. And so that's using all the components of our community are what are important for people.
Yeah. So what should people expect from the Rose House in the future?
A lot. I think as you know, we've evolved from when we first started. There was no manual when I first opened the house. I had to create the manual because I had to figure out, all right, what's our mission? What are we going to do? We want to expand. We want to open more because we're getting to capacity where our houses are filling up, and that's a good thing. It's a good problem to have, but you do want to be able to serve everyone. So we do want to expand the houses. And we want to expand the menu of services that are within the houses. You know, how can we grow and how can we learn? How can we introduce other alternative methods of healing? And I want to put I'd love to have, you know, yards with pools in them, or hot tubs, or, you know, things like that. Just all the things that you would get from a nice bed and breakfast. I want them to get at our Rose
Sound
House.
healing.
Yeah. Okay. Yeah.
Reiki.
Yes. Yes. Yeah.
Yoga.
Yeah, we do. In fact, we do. We just we just introduced yoga into the stabilization center, and we have some staff that will do yoga, and we bought yoga mats and the you know, some weights and some blocks and things like that. And the day one that we brought them in, they started using them, and so it was great. All the guests were just enjoying themselves, and so we do have that in the Rose houses too, but not as much as I'd like to see it. So yeah, all those kinds of ideas and things are they come and go, but we try to keep it consistent.
That's great. Do you have a email address or a contact that people can write to if they want to get involved with the Rose House?
I'll give them my email so that I can give it to whoever, you know, whatever staff I want to. It's S Miccio. It's SMICCIO at people-usa.org.
Great. That's awesome. So we just got 3 minutes left for this episode.
Okay.
Anyway, is there anything else that you'd like to tell the audience?
Yeah, I'd like to say that a lot of senators and politicians have all of a sudden taken notice in what we're doing, and the New York State Office of Mental Health has taken notice in it, and they're licensing now respite houses, which wasn't my ideal, you know, my ask really, but what it's doing is it's allowing us to build more in our communities, and I think that's important. And we were able to actually help the Office of Mental Health write the regulations behind it so that it stays true to its peer, you know, operations, and we don't get involved in the whole Medicaid kind of, you know, world
Debacle.
yeah, we want to stay away from that. We're still going to bill Medicaid, but it's going to be a lot easier the way we've designed it than tradition would have designed it.
That's great. That sounds very optimistic for all of us.
Yeah, I think so. We're really excited and optimistic about the future.
That's great. So thank you so much for being on the show.
Thanks for having me.
You're a game changer.
Thank you, as are you. So
Thank you. And hope to talk to you soon. Thank you for watching. Like, subscribe, and wish you all the best.
Thank you. Take care.
Thank you. You too.